So anyone who is diabetic should have a regular eye exam every year. Just because diabetes itself is pretty common,
Right.
when you do get into an area where it's not controlled. But the big thing is catching it early and understanding yourself and your how your body kind of takes in that sugar. So it's such an individual
Right.
condition that, what works for someone is not going to work for the next person. So I always try to tell patients, once you have diabetes, it's really about learning how you react to your sugars,
Right.
different types of sugars as well.
Sure.
So that's why it's so important to check your sugars throughout the day, because it's not just when the doctor checks it. It's also, are you getting those big ups and downs, or are you
Sure.
just always up? And
That's
you
interesting.
won't know that unless you test it. So anyone who is diabetic should have a regular eye exam every year. And this is mostly to check on the health of the eye itself, because the eye has vasculature that supplies oxygen to the retina. And if that vasculature is damaged in any way, which can be damaged by high sugars, then it can further then damage your vision if it's not controlled. So the big one is just making sure we check every year. There have been studies that are showing supplements like omega-3 can actually help kind of stabilize or decrease any progression in the retina or the vasculature of the retina. But I always advise everyone to talk to their primary care physician to see if that's something they would recommend for them.
Sure.
So that's something you would do even before we see any changes. Of course, we never hope to see any changes on the retina, but that's why we check every year. And, just knowing again where your levels are, because it does vary throughout the day, and we can see diabetic retinal changes if it's either just constantly too high or if it kind of fluctuates up and down too much. Then it basically weakens those vessels, and then that's when they start to leak fluid. They start to leak blood sometimes. And again, when we take those photos, we can show the person, hey, this is what we're seeing if we do see
So
anything.
you would do a yearly photo with like a retinal photo for diabetes for the
Yeah, we
patients
do
with
a
diabetes.
yearly diabetic dilation exam with the
Hmm.
photos
Okay.
to then document good or bad, and then show the patient what we see. It's a great thing for documentation because, again, and education, we can show them those photos and say, hey, I feel like that kind of stands out more to someone when they actually see what's going on versus that me just saying, oh, by the way, I see some changes in the eye.
Right.
But when you see it, it can be more profound to the patient, but
Hmm.
it's also helps us kind of monitor it. And then also, communicate with their primary care physician to say,
Right.
hey, this is what we're seeing,
Right.
so it is a good advantage having it. Is it required? No, but it does help to have these photos just to both educate and then communicate as well.